Is it ever right to choose who should live or die based on the color of someone's skin? In the fight against COVID-19, the CDC came dangerously close to doing exactly that, planning to allow the death of thousands of Americans in a twisted pursuit of so-called social justice. On November 23rd, the CDC's Advisory Committee on Immunization Practices unanimously voted to withhold the COVID-19 vaccine from the most at-risk population, Americans over the age of 65, in favor of much younger and healthier essential workers. Why? Because elderly Americans are more likely to be white, and essential workers are more likely to be people of color. Despite the CDC's own data demonstrating that up to 6.5% more Americans would die if essential workers were vaccinated first, they found that plan more ethical because it mitigated health inequities. Professor of Ethics and Health Policy Harold Schmidt told the New York Times that older populations are whiter, society is structured in a way that enables them to live longer. Instead of giving additional health benefits to those who already had more of them, we can start to level the playing field a bit. For most people like Professor Schmidt, using essential workers as a proxy serves their agenda, since explicitly prioritizing based on race is unconstitutional. However, Harvard epidemiologist Mark Lipstitch disagreed, arguing since some essential workers, like teachers, are very often white, they are not among the most mistreated of workers and should not be prioritized to reduce inequities. However, the left-wing Economic Policy Institute disagreed right back, arguing teachers should be prioritized in the vaccine's distribution because their students are mostly black and brown. It is true that racial minorities are substantially more likely to die of coronavirus. But a study found after adjusting for age, sex, insurance status, comorbidity, neighborhood deprivation, and site of care, that difference disappeared. If our goal is to save more lives, then it's perfectly ethical to direct vaccines to those with such contributing factors. What's not ethical is knowingly sacrificing lives to create so-called equality. The Soviet Union too valued equality over all else, and it kept everyone equally suffering. Thankfully, after public outcry, a month later the CDC reversed their decision, but they came dangerously close to massacring America's elderly. People used to say such radical philosophy was confined to the universities. Now we've seen just how dangerous it has become. I'm Klein. If you liked this video, please give it a thumbs up and subscribe to our channel. Thanks for watching.